So if you're preparing for the MRCGP AKT or CSA, I just want to go through the different courses and revision packages that we offer at Emedica and how they can help you get through with flying colours. So if we start with AKT, we've got our main AKT preparation course. So this has been running for over 10 years. What you'll get by the end of this course is you'll be exposed to high yield questions and key topics. So rapid reviews, short form, concise lectures on key topics for both the clinical domain, the organizational domain, and medical statistics. We'll also have a session on picture tests. A big focus on this course is to look at exam technique. Look at the research. Why do people fail? How can you avoid them? What are the techniques that you can implement to make the most of your revision, but also on the day of the exam, so that you don't just pass, you pass really well. Okay. We'll also go through 2 teaching mocks on the day, done in timed conditions with screens in a very similar format to the real exam. So you really get an idea. How ready are you? How much more preparation do you need to do? But also, why are you getting questions wrong? What are the little things that you could do to make sure that you don't make those simple mistakes? So things that will help you boost your score by the end of the day. And by the end of the day, you'll have a clear idea. Are there particular areas that maybe you didn't realize were even in the curriculum that you need to go away and work on? Are there areas that you're actually doing really well in and maybe you could save some time by not focusing too much on them? Okay. After the course, you'll get a full 200 question AKT mock that's really realistic. So it's 80% clinical medicine, 10% organizational, 10% stats. And we recommend that you sit that about a week, 10 days before your exam. So most of your revision's done. You get a realistic idea, am I ready or not? If not, what areas do I still have some weaknesses in? And you've still got some time to hopefully make some corrections. Most people have told us that they've scored within a few percentage of what they score in that mock in the real exam. So it's been designed to be really realistic. And then we've got our webinars. So we've got an AKT masterclass, how to pass the AKT, that is useful before you've started your revision to get an idea about the exam, how to make the most of your revision, how to sort of effectively plan your preparation. And then we have 3 webinars focusing on the 3 domains. So one is medical statistics made simple, one is organizational domain organized, and one is high yield clinical grammar. Each of these lasts 3 hours. It happens in the evening, it's live, it's interactive. We cover lots of topics, but we also work through, it's very interactive in that you're going to work through exam style questions. And by going through the answers, you'll understand why you got things right, why you got things wrong, start building technique, but also you can ask any questions there and then on anything that you'd like, additional clarification on. So those are our main AKT services. We also have an online revision package with over 1,400 questions mapped to the Royal College curriculum, and it includes a full 200 question mock. And that's different to the full mock that you get after the main AKT course. So that's for AKT. For CSA, we've got lots of different things that will help you. So our main CSA Preparation Plus package, what this involves is actually we're really proud of. We've been running a CSA course for over 10 years, but we piloted and have now relaunched this new format that, if you like, is a complete package. So before the course, we'll send you 2 hours worth of really important lectures, video clips. So that will cover an overview of the exam, what to expect on the day, what your room will look like, what kinds of cases you're going to get, how do examiners mark, what are the simple mistakes that people often lose marks and ultimately fail on, how can you avoid them? What do the 16 feedback statements mean? Exactly what does the examiner look for on the day when allocating marks? Things like breaking bad news, how to structure a good consultation, effective communication and consultation skills, how to avoid being formulaic. There's video clips with some of these things. So that's 2 hours worth of material before you even come. So you've already got a good idea of what to expect on the day, what to start working on, how to approach different types of cases, how to approach things like breaking bad news. So you do that before you come to the course. On the day of the course, we have a Q&A where we go through any questions after you've watched all that pre-course material. The main focus on the course is practice. So we have maximum 6 in a group for practice. We have both male and female role players. There are 2 trainers there on the day that will give you lots of detailed individual feedback. By the end of the day, you will have actually seen 31 role plays. You'll have had 3 full mock cases yourself and another 4 cases that you'll take part in, okay, and get feedback on. So lots of exposure, lots of practice. Go away feeling really confident and with a clear plan. What do I personally need to work on? A big focus for us on the day is, we'll touch on some of the things you're good at, but we're mostly going to focus on what can you improve? What are the changes you can make? And that's individual, it's tailored, it's detailed. So you go away with a sort of real clear idea and a clear plan. What do I need to go and work on? And then after the course, we send you 65 full cases to go and work on. So each case has a doctor's sheet in the same format as the exam. It has a detailed script for the patient in your study group. And then most importantly, the examiner's sheet is really detailed, and it covers the 3 domains: data gathering, diagnosis and management, interpersonal skills. And so, you can actually, the examiner in your group can be observing and really give feedback as to what things did someone miss for each of these. You don't need a separate textbook to look it up. They're all up to date in terms of the current guidelines, and these 65 cases are arranged as 5 full CSA circuits. Okay, so you can use them, to practice lots of cases, lots of different case formats, home visits, telephone triage, dealing with someone who's maybe got an ethical dilemma in there, and a wide range of curriculum areas that we know people struggle with, important cases, high challenge cases. Okay, and you then have a clear idea by the time you've worked through those 65 cases, add that to the 31 cases on the day, the pre-course material, and then post-course we also send you some video clips, 3 full-length consultations, examples of high-scoring cases, so you can see maybe how to use your time, how to split between data gathering, management, how to actually actively demonstrate some of those techniques that we talked about at the course and in the pre-course theory. And then we'll also send you some rapid reviews and clinical topic reviews. So by the end of this, you get 4 months access to these cases and these videos, and so by the end of that whole process, you've been exposed to a lot of different cases. You've covered a lot of difficult areas. You'll go into the exam really confident, thinking, you know what, I know how to deal with challenging situations. I know how to deal with the spectrum of different CSA type cases that can come. So that's our main CSA course, okay? And that whole package lasts just over 4 months. Then we've got our CSA 100 case crammer. So this is really, people find this most useful to attend near the exam. So you've been to the course, you've done lots of practice. Now, near the time of the exam, you just want to consolidate all that knowledge, all that reading and revision and practice that you've done. In one day, you'll be exposed to 100 different CSA cases. These are all different to the cases we've sent you after the main course and seen on the course, of course. And for each one, we'll go through the key things in the history, the important red flags not to miss, what the diagnosis is, how to explain that in clear, understandable language, what are the current guidelines for management, red flags, safety netting, and then also, there's interactive cases. So every 5th case, we have a role player, and we'll do an interactive case. You'll be involved in asking some of those questions and deciding the management, so that by the end of the day, again, you've been exposed to 100 different cases, okay? And you'll see in the links details of what cases are included. So, between those two, that's about 200 different cases that you've been exposed to. Pretty much anything that's going to come up in CSA, you're ready for it. You've seen it, you know how to deal with it. For those that don't come to the course, the main course, you can separately just access the cases online, the 65 cases. They're all downloadable, but you can also print them off if you want, or access them on a screen. And then finally, we've got our clinical case cards, which are helpful for both AKT and CSA. So each card will focus on one topic. It might cover, for example, the key things important in history or in management for a particular condition. Or it might, cover a nice guideline, or perhaps, some important thresholds to know, some things to deal with. Okay, and you can see examples of these in the links below. So, these are some of the different things that we offer that will help you prepare for your AKT or your CSA. Now, whether you're coming to one of our courses or not, if you need any advice or any help with preparation for any part of MRCGP or your training, please do join the GP Training Support Facebook group, or feel free to email me, get in touch with me. I'd be happy to offer advice, support, especially if you failed an exam and you're not sure where to go and you're not sure, why did I fail? We help hundreds of doctors every year, many of them who are resitting, maybe 6th, 2nd, 3rd, 4th final attempt, and we've helped lots of these doctors, thousands over the years, get through their exam successfully, and not just pass, but score really well on that resit attempt. Because once you understand why you've failed and you've developed that exam technique as well as the knowledge, you can really go away and do the work in a focused way, and hopefully that will really help you. So that's just an overview of the different things that we offer for MRCGP, AKT and CSA. Any questions, feel free to get in touch. I'm always happy to help. Thank you so much.